Hello everyone, this is Zhou Jingyi. Suddenly, when you hear the term lifestyle diseases, what kind of people come to mind? Many people probably picture fathers with big bellies or grandfathers and grandmothers, but that common perception may be outdated. Today, I'd like to share some somewhat shocking data released by the US CDC, the Centers for Disease Control and Prevention. It was found that in the 10 years from 2013 to 2023, the health status of a specific generation deteriorated rapidly. That generation is young adults aged 20 to 40. This isn't just a minor fluctuation. It's a quiet emergency that we need to address right now. We are seeing chronic illnesses once reserved for the elderly appearing in people in their prime. Why are we seeing this shift? For decades, chronic illnesses were seen as the sunset of life, something to worry about in our 60s or 70s. But the last decade has rewritten that script. The age group that should be at the peak of their physical vitality, those in their 20s, 30s, and 40s, is showing unexpected cracks in their biological resilience. The CDC's NANES reports highlight that the primary drivers of this burden are not isolated. They are deeply interconnected metabolic and psychological factors. When we look at the data from 2013 to 2023, the trend line for depression and obesity among young adults is alarmingly steep, surpassing older cohorts for the first time. 1/4 of Americans in this age group now report clinical symptoms of depression, a 60% increase in just 10 years. This is a staggering shift in public health. This data isn't just numbers on a page, it's a reflection of a fundamental change in how we live, eat, and interact with our environments in the digital age. The relationship between our physical mass and our mental state has become the most critical medical frontier for this generation. We can no longer treat them as separate issues. Understanding this link is the first step toward reclaiming our health. It's about seeing the body as a single, integrated system. Let's look closer at the two main culprits. According to the report, obesity is the first culprit. Currently, 35.5% of young adults aged 20 to 39 are classified as obese, a high prevalence plateau that concerns researchers. Even more concerning is the rise of severe obesity. For this age group, it has reached nearly 10%. This specific metric has shown no signs of stabilizing, only climbing. The second culprit is depression. The Behavioral Risk Factor Surveillance System notes that prevalence in young adults rose from 16.4% in 2013 to 25% in 2023. This isn't just about feeling down. 88% of these young adults report that their symptoms cause significant difficulty with work, home, and social activities. It is a functional crisis. Interestingly, the data shows educational attainment is an inverse predictor. Those with higher degrees show lower obesity rates, highlighting a socioeconomic dimension to this health gap. Severe obesity is also more common in women than men across every age group in this study, with 12.1% of women affected compared to 6.7% of men. From a medical perspective, these two conditions are like the two wheels of a car. When one condition worsens, the other tends to deteriorate as well, dragging the whole system down. The CDC found that young adults with depression are roughly 1.5 times more likely to be obese. This bidirectional relationship is one of the most powerful drivers of chronic disease today. Sensitivity analysis revealed that the overall increase in multiple chronic conditions was almost entirely driven by the rising rates of these two specific conditions. In fact, when researchers excluded obesity and depression from the data, the significant upward trend in chronic illness for young adults effectively disappeared. That's how critical they are. For example, imagine your smartphone. Obesity is like having heavy, unoptimized apps constantly running in the background, wasting battery power and processing speed. Depression is like an OS system error that prevents the phone from properly charging, even when plugged in. If these occur simultaneously, even the latest model will fail. Depression leads to hormonal changes like increased cortisol, which actively promotes abdominal fat storage. It's a physiological loop that's hard to break with willpower alone. Conversely, the systemic inflammation associated with obesity can cross the blood-brain barrier, altering neurochemistry and reducing your capacity for joy and motivation. This is not a character flaw or a failure of discipline. It is a biological trap that modern societal structures have unintentionally set for this generation. By the time we notice the physical weight gain, the neurological groundwork for depression may have already been laid. We must break this cycle at its biological roots. Why are these conditions increasing simultaneously? I believe it's due to the trap of convenience. High-calorie meals are delivered instantly without any physical effort. Our environment is designed to keep us sedentary while bombarding us with processed sugars that spike our dopamine and then leave us in a deeper metabolic crash. Mental exhaustion from social media is constant. The habit of comparing our internal reality to curated digital lives leaves the brain with zero time for genuine recovery. When inflammation occurs in the body, it directly impacts the brain. Substances released from fat reach the emotional centers and physically reduce your motivation. This can lead to a state called anhedonia, where you lose interest in the activities you once loved. It's a hallmark of clinical depression fueled by metabolic health. It's not that you stay inside because you have a gloomy personality. It's that your physical condition is chemically altering your mood. This is a purely medical mechanism. This creates a vicious feedback loop. Depression leads to comfort eating as a form of self-medication, which leads to weight gain, which further deepens the depression. Understanding this mechanism is liberating because it removes the shame. It's not a character flaw, it's a physiological response to a high-stress, high-calorie environment. Recent research also shows that gut health, the microbiome, plays a massive role in regulating mood. Your gut is often called your second brain for a reason. The gut produces up to 95% of the body's serotonin. If your diet is damaging your microbiome, you are essentially starving your brain of its primary happiness chemical. We are essentially seeing a metabolic crisis manifesting as a mental health crisis. They are two sides of the same biological coin, and they must be treated together. It's also worth noting the pharmacological link. Certain antidepressants can correlate with weight gain, creating another layer of complexity that requires expert medical guidance. Now, a point to note. This data is from the US. You might think, Japanese people are naturally thinner, so these lifestyle diseases don't apply to us. But that's a dangerous myth. The trend in Japan is equally serious, just manifested differently. The MHLW's new Health Japan 21 plan identifies specific risks for our younger generations. We are seeing silent malnutrition. Young women in their 20s are averaging only 220 grams of vegetables a day, barely 60% of the recommended target. 1 in 5 women in their 20s in Japan are underweight. This thinness is often a mask for severe muscle loss and micronutrient deficiency that leads to long-term illness. Sleep is another massive crisis. Japan has the worst sleep deprivation in the OECD. 48% of working-age adults sleep less than 6 hours a night. This is unsustainable. Chronic lack of sleep is linked to presenteeism, being physically at work, but mentally and physically underperforming due to exhaustion. It's a massive drain on our society. Loneliness is a quiet emergency in Japan. 60% of men in their 30s feel lonely often or always. This social isolation is as dangerous as any physical disease. Loneliness and diet are inextricably linked. Socially driven malnutrition, eating alone, leads to much higher odds of low fruit and vegetable intake. We need community. The mortality risk of social isolation is comparable to smoking 15 cigarettes a day. It is often more lethal than physical obesity alone in the long run. This combination of quiet malnutrition and loneliness is uniquely impacting Japan's 20s and 30s, setting the stage for a wave of chronic illness as they age. Persistent lack of sleep and poor nutrition is already leading to a rise in early-onset cardiovascular diseases among populations that used to be considered safe. The government's life course approach recognizes that the metabolic health of a 25-year-old is the most accurate predictor of their health at age 80. Every day counts. The savings you make in your health during your 20s and 30s will either generate massive interest in longevity or become a crushing debt of illness 30 years from now. You are standing at that crossroads right now. The decisions you make about your lunch, your sleep, and your social connections today are the most important ones you'll ever make. I've shared a lot of heavy data, but please don't be overwhelmed. Our bodies are remarkably resilient and can be changed at any time. Change starts with awareness. First, know. Take an objective, non-judgmental look at your weight, your sleep patterns, and your mood swings. Tracking the data removes the emotional weight of it. A small reset. Even just walking for 10 minutes a day without your smartphone can lower your cortisol levels and improve the OS system errors in your brain. Your body is the only partner that will be with you for your entire life. Why not take a little care of it today? You deserve to feel good in your own skin. Focus on addition, not subtraction. Aim for just 1 extra serving of vegetables a day. Small, consistent additions are more effective than drastic, unsustainable restrictions. Prioritize sleep hygiene. Turning off blue light screens 30 minutes before bed allows your brain to enter the repair mode it desperately needs to stay mentally sharp. I, too, feel the weight of a busy environment. When that happens, I pause and enjoy a cup of delicious Japanese green tea. It's a moment of metabolic and mental peace. Connecting with others over a healthy meal can fight loneliness and improve your microbiome simultaneously. It's the most powerful medicine we have. The health of our generation is in our hands. Small, daily steps lead to a vibrant and healthy future. Let's start this journey toward resilience together. Remember, progress isn't about perfection. It's about consistency and kindness to yourself. Every small choice you make is a vote for your future self. Let's rewrite the narrative for our generation. We are not defined by these risks. We are empowered by the knowledge of how to overcome them. Your body is a vital partner that you'll have for your entire life. Why not take a little care of it, starting from a young age? This has been Jo Jingyi. If you have any questions or want to share your own journey, please feel free to leave a comment. I read everyone. Goodbye. See you again.